Hello, everyone, and welcome to today's Better Care Playbook webinar, made possible through the support of the Seven Foundation Collaborative. Today, we are discussing the Clubhouse model, designing communities to empower people with serious mental illness. My name is Hadley Fitzgerald, and I'm a Senior Program Officer at the Center for Healthcare Strategies, and I'm excited to have you here. On the next slide, we'll go through some logistics. To eliminate the background noise today, your audio lines are muted. However, we do want to hear from you. So there's going to be a Q&A session at the end of our webinar today. And to submit questions for that Q&A session, you can submit a question anytime by clicking into the Q&A icon located at the bottom of your screen. Also, we are recording today's event and we will share it publicly on our website, bettercareplaybook.org. And on the next few slides, I'm going to review our agenda and introduce you to our speakers. So the agenda on the next slide is something I'm really excited about. We're going to start by hearing introductions of our presenters, and we'll learn from them as they're leaders in the field who are implementing and participating in the Clubhouse model. And they'll explore for us some key Clubhouse elements, how Clubhouses fit into the larger landscape of mental health services, the evidence behind the model, and even how to start up a Clubhouse. And we'll end, like I said, with that moderated Q&A. So please, remember to drop those questions into the Q&A box located below. And we'll get to as many as possible as we can at the end of the session. And on the next slide, I'll just quickly introduce you to the Better Care Playbook for those of you who may not be familiar. The Playbook's an online resource center for evidence-based and promising practices to improve care for people with complex health and social needs. And every month, we are summarizing new journal articles, evaluations, and implementation tools. And we also develop resources like today's webinar, which are all designed to help translate the evidence and research into practice. And you can explore more about the playbook at our website, bettercareplaybook.org. And on the next slide is some information about our funders. So we are coordinated by the Center for Healthcare Strategies through support from these leading national healthcare foundations: Arnold Ventures, the Commonwealth Fund, the John A. Hartford Foundation, the Milbank Memorial Fund, Peterson Center on Healthcare, the Robert Wood Johnson Foundation, and the SCAN Foundation. And we are grateful for their support. And now I'd like to welcome our presenters. First is Rita Chang. Rita is a member of the communications unit of Fountain House, a clubhouse in New York City. Rita holds an AD in Human Services from City University of New York, BMCC. Outside of her work in the Fountain House community, she is also a travel enthusiast. Next, we have Lori D'Angelo, who is the executive director of Magnolia Clubhouse, which is located in Cleveland, Ohio, and she has been with Magnolia since 1997. She obtained her doctorate in clinical psychology from Case Western Reserve University, where she is now an adjunct clinical faculty member. She is also a medical advisory board member of NAMI's Greater Cleveland chapter, and NAMI is the acronym for the National Alliance on Mental Illness. She's also a board member of NAMI Ohio. She also serves as a faculty and advisory council member for Clubhouse International, and she's on the advisory board of the Clubhouse Program of Research. And finally, she's also part of Fountain House's Center for Leadership and Education. Next is Sameen Reed, who is the program director of the Silver Center at Fountain House. And she's worked on the Fountain House Advocacy Committee as well. She's worked in the mental health field for the last 16 years and received her master's degree in social work from Fordham University. And in her free time, she has a love and passion for music. Jack Yatsko is the Chief Operating Officer at Clubhouse International. His career in mental health spans 37 years, and he's been with Clubhouse International for 21 years. He works closely with Clubhouse International training centers and faculty for Clubhouse development. He develops new clubhouses, and he provides technical assistance to many existing clubhouses and groups or individuals seeking to learn more about the Clubhouse model. He began his Clubhouse career in Hawaii in 1989 at Friendship House on Kauai, and he continues to reside on Kauai, although his travels take him across the globe. So clearly, we have a very talented and passionate group with us today. We're very grateful for that. And now, without further ado, I'll turn it over to Lori to begin the presentation. Lori?
Hi, everyone. We're honored to be here. Thank you for the introduction, Hadley. The Clubhouse model has been around since 1948, but we are still bringing it to the attention of more and more people. So I'd like to start with giving you a little background. Next slide, please. The prevalence rate for mental illness is 1 in 5 people, and that's across the world. 1 in 20 people live with serious mental illness. And mental illnesses often reduce people's life expectancy by 25 years. And that is something that could be prevented. So next slide, please. You may not realize, but less than half of the people who live with mental illness get any treatment. And the result of that is 1/3 of the homeless and at least 1/3 of those incarcerated are people living with mental illness. Next slide, please. So what does treatment look like when people do receive it? Next slide. Historically, biological models have predominated, which means primarily people get medication, and the discovery of medication that helped calm people led to deinstitutionalization in the late 40s and early 50s, which meant that for people that had been hospitalized for the majority of their adult lives, now the option was they could be a part of the community because some of the more agitated behaviors were reduced and people could be calmer. However, treatment did not follow people into the broader community, and oftentimes people don't necessarily think that people with a severe mental illness can recover and can be productive members of society. Treatment primarily is social service supports, social workers that ensure people's primary needs are met, and it's very important work and very challenging, and the workforce is limited for this. There's limited therapy. Often vocational rehabilitation is very time limited, and if people are not successful within 90 days, they're often not continue to obtain vocational supports. And there is partial hospitalization, which is generally short term. So the Clubhouse model turns this upside down and really fills a void that exists in our current system. It's an intentional therapeutic community, which means that people come together and the staff support a very focused therapeutic community to help promote people's recovery, and people who live with mental illness are partners in that community and in providing that support. We integrate both having the community of members within a clubhouse and staff, as well as being a bridge to the broader community. And it's a very holistic approach. You'll hear more details, but clubhouses have work of operating the club. They also look at to ensure that all of people's needs are met. And we help support people going on in employment or becoming employed for the first time, going on in educational goals, and we address people's housing to make sure that they're in the best living circumstances that we can help them get. We also are providing education to the broader community, and we are involved as a network and as individual organizations in advocacy, both at the individual level for each of our members and our communities, but also we're connected to provide advocacy nationally and at times internationally to promote the circumstances for people living with mental illness. And the model also focuses on promoting health and wellness and general health care as well as mental health care, and integrating that into the supports of the Clubhouse community. Next slide, please. So we address the determinants of healthcare, which is now a sort of a newer concept, the value and importance of looking at the broader picture for people to promote their health, period. And the Clubhouse has been doing this for many years, as you just heard. Next slide, please. Some of the details of how we're educating the community. Many clubhouses are a part of crisis intervention training for police officers, which is done across the country. We also, at our clubhouse, provide training to emergency workers, EMT and EMS workers. Our organization has been involved in advocacy, and both with other clubhouses organized with Fountain House to promote public policy changes. And one example of an effort we were successful with was to promote a mental health response to mental health crisis when the police aren't needed. And we're happy to say that that program is starting and piloting this summer. We partner with advocacy organizations such as NAMI and promote the integration of clubhouse members and leaders around our local environments, our state, and our country, as well as internationally. Next slide, please. One of those pictures is a football player of the Cleveland Browns who came and visited. And the mayor recently visited, I'll add, and was very engaged and very supportive of the work. And he's new, and he was very excited to learn about it and to promote what we're doing across the country. The clubhouse model is standardized. Standards were developed and in the late 80s and early 90s, and there's an accreditation and training process, which Jack can share more of. Just some of the main standard points. People choose when they come to the clubhouse, how much they come, and what they do. It's open to anyone with any mental illness. It's a lifelong opportunity. We work together as a community to promote recovery, and the shared work is the method of rehabilitation. And you'll hear some more about some of the outcomes as a result of belonging to clubhouses. So I'll just emphasize, clubhouse members have less loneliness and less social isolation. Next slide, please. So the main research findings, and this is an evidence-based practice. I mentioned we reduce isolation. Family members report improved relationships and improvements for their family members. Clubhouse members have higher rates of employment with longer job tenure and higher rates of pay, and an improved quality of life. Next, please. Other major research findings are clubhouse membership results in lower rates of hospitalization and incarceration, and a year at the clubhouse costs less than a week in the hospital. Members also have lower healthcare rates in general. Next slide, please. So Fountain House, which you'll hear more about in a minute, was established in 1948, and now there are over 355 clubhouses around the world. We're happy to say we're expanding clubhouses in Ohio, and we are in 33 countries and 36 states, and there are 12 training bases across the world. Next slide, please. Well, now I turn it to our friends at Fountain House, and let's hear from Rita.
Hi, I'm Rita Chang. I've been at Fountain House since 2002. I left because I was overwhelmed, and in 2006, I returned to Fountain House. I became more active and more present at Fountain House. Coming to Fountain House was a process, gaining new skills, knowledge, and about myself, and rediscovering myself from employment, education, housing, and understanding how to navigate my serious mental illness and recovering from it. Coming back to Fountain House, I realized I discovered the beautiful green doors, the hustle and the bustle of the work ordered day, and reducing my isolation from being at home all the time. For me, getting up is really hard. In the morning, preparing and leaving to get on the train is hard. While on the train, I think about what task I'm going to do for the day. and see how it's gonna go. And so there's a whiteboard and we start at 9:30 in the morning. It's the work order day and we sign up for the tasks throughout the morning. And at 1:30 in the afternoon, we have, we continue our task and start new task in the morning, in the afternoon. I was offered three transitional appointments, TEs, from various office work, and one supported appointment, which is an SE. Along my journey of recovery, I went through personal highs and lows. One low was losing my apartment from an eviction process, where Samid helped me and went with me to my housing court, and times I would go by myself. My high was when I secured a supportive apartment in Manhattan, and Samid helped me move in with other social practitioners and members. I lived with a roommate for 3 years. Later, I graduated into a solo apartment, which is a supported apartment, which I currently live in. The Found House also has supported me in going to college and getting my degree. So Neen came to my graduation. She met my family, had lunch together. I was proud of myself for that, accomplishing my goal. I really worked hard in achieving my recovery and grow as a person. Found House has helped me to speak up more, have my voice heard. It's giving me confidence, giving me choice in whatever that can help my mental health recovery. It's a community where it's just participating. It's togetherness and working side by side. And we learn from each other. Members teach staff how to do certain tasks that they already know. I taught Samin how to do the data entry in our unit. In 2003, I was selected to represent Found House in exchange with another clubhouse in London, Mosaic Clubhouse, for training for 2 weeks with another staff, Megan Kelly. We stay there together. Not only does going to another clubhouse help, not only does it going to another clubhouse with another staff, you get to also learn about another staff besides Samin. So we brought information back from the clubhouse. Also helped me gain my voice, having my opinions heard and validated. I was excited to go because it was my first time being out of New York City and explore new culture and new city, and see some similarities between Found House New York. Found House has opened the door to a better me and have gained my independence from my mental health.
Well, thank you so much, Rita. We can put up our next slide. And I'm Samin Reed, and I would like to thank Rita for her story. And Rita's story is not the only story like that. There are many stories like that in the clubhouse. Our next slide. So just a little quick history on the clubhouse model. It started from the members. It started in 1944, where 7 patients came out of Rockland State and came together on the steps of New York Public Library to form what we call WANA, We Are Not Alone. And they shared information and came together. And from their first steps, it started Fountain House in 1948. We're called Fountain House because the first initial location had a fountain in its garden, but that program has grown from not just 48th Street, but continues to grow around the country and world, and you'll hear about that later on from Jack. Our next slide. So what is a clubhouse? Fountain House and the clubhouses around the world, we use community as our therapeutic modality. In the clubhouse, the work is designed by its members for its members, so that the work that is done is to enhance the Clubhouse community. The work is the tool that we use to engage members and build relationships. The work is not formal training, but it helps members with their in other areas of their lives. There is a great intentionality behind the model, and it is very strengths-based. And as Rita did say, yes, she did train me on the data when I first started in the employment unit, and that's not unlikely here. Members are training staff, training other members, staff are working together, and we work together as a community. And the goal of us working together is recovery of our members. And the work that we use are the tools to help build self-confidence of our membership and help them in whatever their recovery goals look like. And along with that, just to bridge the gap of isolation, as Rita spoke about in her story, getting up, coming here, getting on the train, and connecting with community. And at the Clubhouse, we focus on the whole person. The beauty of the Clubhouse model is that we get a chance to see people through their life as long as they want to be members. Their choice is so important. So I have been able to have a great relationship with Rita over the years, and not just Rita, but other members throughout this community. All right, next slide. And one thing that we have started to do more at Fountain House is looking at what are these elements of what we call social practice. And when there are 5 elements to social practice. And when we look at it, we start off with our transformative social design and how it fosters the need to be needed. We build relationships with this core, a key component of the work that we do. And it helps to bridge the gap of isolation. We engage members and purposeful inclusion in the Clubhouse activities and helping them to foster choice. The beautiful part is that there is naturalistic feedback and intervention, so it happens right on the spot. And we're able to take risk and gain new skills in that moment. Along with that, we go into transitional environments, like Rita spoke about, employment and education, and we support our members in returning back to the larger community. Next slide. And Rita, would you like to say a little bit of what meaningful work feels for you?
Meaningful work to me is coming in through those green doors and greeting our security guard in the morning and just saying, good morning, and walking in and going into my unit and saying good morning again to everybody in the unit, and just starting off the day by just doing the whiteboard, the task of the day, and helping people, helping other members know how to do the switchboard or know how to collate the paper on Fridays, and just socialize and be with other people throughout the day.
Yeah. And like Rita said, the meaningful work it's the work that is meaningful for the community. So the community creates its work and that work promotes self-esteem, it limits isolation and loneliness, it promotes compromise, and it encourages self-efficacy and diminishes negative thoughts, and including self-stigma, and it helps to build resiliency. Next slide. And how is the community therapeutic? It generates opportunities that the individuals can take advantage of and feel free to be comfortable taking risks and developing self-esteem and self-efficacy. There is mutual aid and support between members. We, like Rita's story, she expressed housing. I remember those housing court days, and the joy of helping you move into your own apartment, and helping to apply for benefits, looking for employment, and along with that, providing opportunities for people to have a real social network. And even for the staff and social practitioners of the Clubhouse model, it is this model is also therapeutic for those working here. I would say that during my tenure, Rita was really inspiring. I remember her going back to school, but not just Rita, but many other members going back to school. And that gave me the push to go back to school and get my master's degree. And I think that that's the beautiful thing about the Clubhouse, is that we're truly a community. We support one another, and we get a chance in this model to work and see people grow through the years. And that is really, truly a wonderful experience of working in the Clubhouse community. And now I'll pass it over to Jack.
Jack,
Next
there you
slide.
go.
Hi, everybody. So glad to be with you today. Thank you, Samin and Rita. So I'm Jack Yasko with Clubhouse International, and we are the coordinating center for these 355 clubhouses. And I'll touch a little bit later about what exactly we coordinate. But our vision is a world where people with mental illness recover and are an integral part of society. Our mission to do that, if you will, is ending social and economic isolation for people with mental illness by growing the number and quality of clubhouse rehabilitation programs worldwide. And these are some photos of some clubhouses around the globe. The one on the left is in India, CVAC Clubhouse in Calcutta. Next slide. So Lori mentioned this earlier, but I wanted to show you a little bit of a map of where the clubhouses are at. We have 247 of them in Canada and the United States, 72 in Europe, 25 in Asia. In Asia, it's Hong Kong, mainland China, Korea, Japan, and Taiwan. We have 6 in Australia and Papua New Guinea, 3 in Africa, and 2 in South America. We also have more than 60 new startup groups, and these are groups of mostly families or mental health centers that have individuals and social workers, therapists that are part of groups that want to start clubhouses across the globe. Next slide. So here's what we coordinate. We're responsible for the international standards for clubhouse programs. So when Lori referenced those earlier, there's these 37 standards that, holding them up here, but they basically encompass the ethics for staff and the philosophical principles behind the clubhouse model. They're categorized into 8 categories, but these standards are updated every 2 years. So they're not like etched in stone in a tablet. The world evolves. And so every one of our clubhouses has the opportunity to give input to add new standards, change, modify standards, and we coordinate that process with our 355 clubhouses. Second area we work in is in training. We have 12 authorized training centers, and I'll show you a map of where they're located. But the curriculum design, the immersion experience at our training centers, the action planning process, the discussions that are held are all done. We meet collectively with all 12 training centers at least 4 times a year via video conference, and then one face-to-face meeting to really look at what's working in our training program, what do we need to change. We try to really anchor ourselves on both fundamental practices, but also innovations that come our way with helping to get young adults more engaged into clubhouses, expand our employment supports, a wide range of ways to build upon the standards. And the training centers, first and foremost, are clubhouses, but they're really strong, excellent clubhouses that have been designated as training centers. A key area that we also focus in is quality assurance. Many of you out there are familiar with CARF, JCO, other accreditation bodies, and we run a formal accreditation program where we evaluate the compliance of our clubhouses with those 37 standards. Our faculty is comprised of members and staff of clubhouses that nominate members and staff to the faculty, and they need to complete a rigorous faculty training program. But when Rita and Samin were talking about how members have leadership opportunities in clubhouses, we feel like Clubhouse International, we're walking the walk and talking the talk that way ourselves when members are on our board, our advisory council, and our faculty at all of our leadership levels in our work. And so clubhouses go through this quality assurance to really look at how they're operating in compliance with the standards. We also work in the area of expansion. That's a big part of my focus with helping groups start clubhouses. We get close to 100 emails a day with people just inquiring and the stories that most of you know out there of My loved one was going to school. My son or daughter was doing okay, but in college, started to hear voices, started to have anxiety. Long story short, they've been in and out of the hospital. We have a treatment provider, but we don't have anything else. They're sitting in our basement playing video games, and they've lost hope and meaning and purpose in their lives. We heard about this model. How do we get one in our community? And I'll provide some tips on that a little later in my presentation. But that area of expansion, we provide a training in. We also provide a lot of technical support to the 355 clubhouses. In our work, plagiarism is a form of flattery. I am calling Lori D'Angelo. I am calling Kinga and Lisa from Fountain House and sharing resources with clubhouses. I don't know how many times like a clubhouse might just call and say, hey, we're writing a grant for a van. Do you happen to have anything? And boom, we're emailing them out copies of a grant for a van. I send a lot of architectural plans to clubhouses that are looking to expand their space. And so while a clubhouse, like what Rita and Sameen were talking about, how a clubhouse is kind of like a family to its members, so too is the global movement of clubhouses sharing resources and providing ongoing support. And we're kind of like, we coordinate that network. We also are involved with public awareness. I think this area, clubhouses and Clubhouse International, need to really strengthen because I don't know how many of you out there have even heard of us before. So obviously, we need to do better with not being a secret of mental health, but being loud and proud and making people aware of that the Clubhouse model has been an evidence-based practice, and we want to open more clubhouses. To my way of thinking, every community has senior centers, Rotary clubs, boys and girls clubs, well-respected churches. Every community also has people with a mental illness, but not every community has a clubhouse. And that's our aim, is to try to grow and strengthen them around the globe. We also have conferences and seminars where we have an array of 50 to 60 workshops and institutes and plenary sessions on both the fundamentals of the clubhouse model and innovative practices. We get involved with advocacy, as Lori mentioned earlier. We sometimes run into NIMBY, the Not in My Backyard acronym, where communities might feel like a clubhouse is going to drive down our property values, or it won't be safe. And we work a lot with clubhouses in dispelling those myths, providing testimonials at public hearings on clubhouses. There's no validity or truth to the fact that property values go down when a clubhouse is in a community. Clubhouses add value, don't detract value. And the safety issue is there's no efficacy related to that whatsoever. We also have a program for clubhouse research, and Lori alluded earlier to some of the studies affiliated with not just the deliverables and outcomes of helping people with employment, education, and housing goals, but also on the cost savings of a clubhouse. One statistic I'll cite for you is that 40% of the average daily attendance in an accredited clubhouse has its members employed in jobs in the community. Now, nationally in the US, that's about 15 to 18%. So we almost triple that average with our array of employment programs provided through clubhouses. Next slide. Here's our training centers. So there's 5 in the US. Fountain House is one of them in New York. Genesis Club is in Massachusetts. Gateway House in South Carolina. Independence Center is in St. Louis. And Alliance House is in Salt Lake City, Utah. The rest of these Progress Places in Toronto, we have 3 in Europe. Rita mentioned Mosaic Clubhouse in London. We have a training center in Norway and Finland, 2 in Asia, in Korea and Hong Kong, and 1 in Australia. Next slide. It's one thing for us to talk about our model and speak proudly about it. It's better when other people are saying good things about us too. And Fountain House and Clubhouse International won the 2014 Hilton Humanitarian Prize, which is the world's largest annual humanitarian prize presented to a nonprofit organization judged to have made extraordinary contributions toward alleviating human suffering. We are the only mental health organization to win this prize, and our clubhouses use this when they're talking with employers. They use this when writing grant proposals. We're very proud of this award, and it's, again, an outside organization recognizing this model as a good practice. Next slide. The World Health Organization, on their guidance on community of mental health services, recognized the Clubhouse model in 2021 as promoting a person-centered and rights-based approach. And so we were proud to be to get that endorsement from WHO. Next slide. We received in May of 2021 a special commendation award from the APA, the American Psychiatric Association, in recognition of our worldwide efforts to assist people living with mental illness recover and live meaningful, productive lives. Next slide. The Brain and Behavior Research Foundation presented us with an honorary Padres Humanitarian Prize. This photo is of Joel Corcoran, our CEO, receiving this award, and Jeffrey Bornstein, who's the president and CEO of the Brain and Behavior Research Foundation. We included this quote of where he said, "These talented and accomplished leaders are striving to expand the reach of mental illness treatment here in the US and around the globe. They serve as extraordinary advocates for mental health and inspire us all to use our knowledge toward the greater good for all humanity." Next slide. So I want to shift gears a little bit and talk about partners in care and training. This is something that you may be interested in. It's a free on-demand course, and it's open to mental health professionals, including psychiatrists, psychologists, psychiatric nurses, counselors, social workers, OTs, really any health professional who provides services to people with mental illness. And CEUs are provided through NEI Global. We work with them to provide CEUs in this regard. And the objectives of this training that's provided by Fountain House, Magnolia Clubhouse, Wayne State University, and Clubhouse International is, one, to increase awareness and resources for recovery-oriented approaches. Two, to increase the understanding of the effectiveness of clubhouses in assisting mental health professionals to improve the health and social health of their patients. And three, increase partnerships and collaborations among psychiatrists and other mental health professionals with the Clubhouse model and persons with lived experience. Next slide. So we really see community as part of an integrated healthcare system. It's one thing for folks to get their psychiatric care from therapists, medications from psychiatrists, but we also feel the second part of this is the health promotion and rehabilitation aspect of it, which we believe clubhouses are really good at in helping members re-enter the worlds of work, education, housing, and also focusing on wellness. One of the slides that Lori showed earlier showed a statistic of people with mental illness dying 20 to 25 years earlier than people without a mental illness. When you think about that, if there was any other illness where people were dying 20 to 25 years earlier than people without that, that would garner so much attention. But because it's mental illness and it doesn't have the cachet and then there's so much myth and stigma associated with it, we don't get that attention. And it's our job to bring that to the attention of funding bodies, government officials, and people associated with broadening the funding for organizations like ours. Next slide. So in the Partners for Care, what clubhouses can do for providers, there's about 7 bullet points here, but I really think that this engagement towards full recovery, I go back to when I was working at a clubhouse, and so many times members were afraid to speak up when they were meeting with their psychiatrists about the medication that they were taking, whether it was helping them, whether they couldn't get up in the morning, they wanted to go to work, but they were too groggy. Many of us who work at a clubhouse accompany members to those appointments to help be a voice for people who are otherwise a little bit intimidated in that process. So we want to be partners with providers. We also help provide a multifaceted understanding of the person because they're coming to the clubhouse 1 day a week, 5 days a week, 5-6 hours a day. We get to know them as people, not just as patients. And that can really, we feel, can help providers with their treatment options in assisting people with mental illness. And I think the bottom line is that clubhouses provide hope. And that linkage for providers, we think, can be a win-win. Next slide. What can providers do for clubhouses? Refer new members, get involved. I'm going to show you our website at the end of my presentation. Go and look. We have a box on our website that can show you where a clubhouse is in your community. And we would welcome you to call them and go see one for yourself. There's nothing like going to see a clubhouse and experiencing the work units, the relationships that Samina and Rita spoke to, and just the high energy that clubhouses have. We feel that providers can get involved with providing long-term care and supports working with clubhouses, and improve the overall healthcare experience for members. Next slide. So my last piece is just to give you a few nuggets on starting a clubhouse. Enlisting the help of the right people, participating in a new clubhouse development training. We run a 2-day training. When we run it in person, we run it over 2 days. When we run it virtually, we do it over 3 half days. And this is around designing training around the infrastructure of a clubhouse. While Fountain House and the other 11 training centers provide the operations training of how do you do a work order day as our milieu? What is this about the relationships? How do you provide community supports, employment, education, all those kinds of pieces of the international standards? Before you get to that, you need money, you need key people, you need folks who are going to be invested in starting the clubhouse. And that's what this training's about. Next slide. So you want to think about individuals in your community and who might those individuals be. They could be people personally motivated to create a clubhouse, family members, people with a mental illness, professionals in the field, people who know how public mental health funding works. Those are great folks to talk to. People from the legislative political arena who have influence in funding or not funding clubhouses. People with expertise in creating a nonprofit organization. People from the business community who hopefully will be potential employers. People that can help with introductions and access to people and organizations, folks with foundations, businesses that perhaps can provide private funding, and anyone who's ready, willing, and able to help. Next slide. You first want to educate yourself and educate the group about clubhouses. And some ways to do that is touring an accredited clubhouse, downloading and reading literature about the clubhouse model. Magnolia Clubhouse, Fountain House, Clubhouse International we all have websites with a lot of information and literature that talk about the clubhouse. There's research findings. So you want to really educate yourself. There's videos and films where you can see numerous clubhouse videos, 3-4 minute videos that will give you a snapshot of what they look like and how they operate. Coming to our conferences and seminars are great ways to learn about the model and network and enhance your sphere of people that know about this model. And talking to clubhouse members, staff, and board members. Clubhouses are proud to show themselves off. And so you won't get any pushback if you call a clubhouse and say, hey, I heard about this thing on a webinar. I see you guys in this directory. Can I come by and have a look? They'll welcome you to come there. Next slide. You want to educate key stakeholder groups and ask for their help. Again, these kinds of groups are consumers, people with lived experience, mental health advocates, NAMI, MHA, any of those kinds of organizations. The existing mental health funding system, social workers, OTs, voc rehab people, Veterans Affairs, anybody who has a linkage with the mental health system, legislators, and foundations. This is a photo of Haberste Clubhouse in Tallinn, Estonia. Next slide. You need to think about when you're starting a clubhouse. Clubhouses operate one of two ways. They're either their own 501c3 nonprofit organization with a board, nonprofit tax exempt status, or they're operated under the auspices of either a mental health center or another agency. In the United States, about 65% of our clubhouses are operated through a mental health center. About 35% are operated as freestanding entities. But in our training, we talk about this in detail, about the pros and cons of each option, and what works for each community could be different. But those are the two ways that clubhouses are operated. Next slide. You need to talk about funding. Obviously, you need to get the funds to start and open your doors. And so we talk about public buckets of money and private buckets of money, and the importance of having a diversified funding stream. If you're sole source funded, governor may love you now, election happens, governor changes, the next political leadership may not. And so in this training, we talk a lot about different types of funding streams. We include sample grants. We include clubhouses to network with if you're looking for specific types of funding. But you want to really explore that when you need to get the funding to start the clubhouse. There's no two ways about it. Next slide. You want to create an action plan, and that's what we do in this training. Each group that comes to our training has a mentor that works with them for up to a year afterwards. And in this training, you create a vision statement, you identify your startup group and who else you want to bring onto your team. You choose a group leader. You're going to talk about how you educate yourselves, who are the right people for your group, how are you going to approach them, who's going to approach them, when are they going to approach them, who are your key stakeholder groups. When and how will you create your board? What are your funding options? How will you ask for funding? Who will do each step, when it will be done? So you're going to have a detailed goal plan with objectives with timelines to them that we go over through 7 exercises in this training. And so, next slide. If you want more information on our training, the Partners in Care, anything about Clubhouse International, this is our website. Our staff team is comprised of about 70% of our staff. We have 11 staff members, and the majority of them have all been born and raised in the Clubhouse field. They've been staff generalists. They've been vocational, work closely with helping members get jobs in the community. They've been directors, and we have a strong fundraising team. And we're here to help. We want to talk to you more about getting a Clubhouse in your community, and we appreciate the opportunity to share with you today a bit about the Clubhouse model and about Clubhouse International. And with that, I'll turn it back over to Hadley.
Wow, thank you so much, Jack. Thank you, Lori, Samin, and Rita. We're now going to move into the Q&A part of our webinar today. Do want to just first say a special thanks to Rita for sharing your journey at Fountain House. It really helps, I think, illustrate what a clubhouse can mean for people in terms of helping achieve goals. So special thanks to Rita for sharing. I'm going to ask all of our presenters to turn on your cameras, and we're going to start going through some questions that we received during the webinar today, as well as some questions that we received from our audience members when they registered. So let's see. And I also just want to note, you can still add some questions in if you have one in your mind that you haven't asked yet. Please don't be shy. We have a group of people from across the country today, your providers, advocates, government officials. We have representatives of health plans in our audience today. So please, please chime into the discussion in the Q&A icon at the bottom. Well, so to get started, we received a couple of questions, I think, on funding. And I know, Jack, you touched on this, and Lori, you and I have had discussions about this in the past. So it would be wonderful, and maybe I'll start with you, Lori, if you could talk a little bit about how, the model is funded, how it works for Magnolia House and how it works for others.
Thanks, Hadley, and great job, everybody. I really enjoy talking about funding because it's always a challenge. And our clubhouse was started in 1961, so it's got a long history. And the funding over all that time primarily was at the county level. In our state, there are mental health and substance abuse boards that are government entities at the county level. The funding is a mixture of tax levy dollars and state funding that's distributed to the counties. And the county mental health boards then decide where those dollars go. Eventually, well, Medicaid services cover some of the services that people receive to help them live with mental illness. But the clubhouse model was not in that mix for many, many, many years. We advocated as our state changed its Medicaid plan, and that happened over a couple of years, probably in 2016 and was finished in 2018, to get this model into the state Medicaid plan. We're in a broader service. It's got its own name in Ohio, but it would be most similar to what most people would see as day treatment. The model that we're doing is not similar to traditional day treatment. It's the clubhouse model, the way you've all heard it just now, but that funding stream is good. It allowed us to expand. Over the years I've been with the organization, and prior to that, there's been interest around the state of Ohio to have clubhouses, but the discretionary dollars were very limited. So it was really hard for people to get their county boards to provide enough funding like we had. And so now we have both sources, and it's really important to have more than Medicaid because not everybody has Medicaid, and to have a good reimbursement rate. But it works really well for us. The biggest change to the organization was daily documentation. And that takes some time, but people organize. Staff and members can do that note-taking together if they'd like. Members are always aware and are welcome to be a part of it. The staff take usually about an hour a day, earlier in the day or later in the day, and stagger when they do their notes. And so it all fits. We have not changed at all our integrity to the model. And that's what I would encourage people to advocate for. The funding is not limited. It's not time limited. There's no limit to the duration. Does not have to be authorized in advance by someone else. So we're really fortunate, and we're sharing. We learned from other states. There were some states using Medicaid, and we reached out to those states and learned how it was working and what the pros and cons or obstacles that they would encourage that we could learn from. And so I think I'll stop there, but we do have some private funding. It's great to have a mixture, and we're hoping more states will see the value and the outcomes from this model and implement it in their Medicaid plans as well.
Can I add to that, Hadley? So over 100 clubhouses in the United States get Medicaid funding. But in our experience, if you know one Medicaid's a federal program, but if you know one Medicaid plan, you know one Medicaid plan. Lori alluded to how they bill their services. We did a survey with all of our clubhouses who get Medicaid funding, and if anybody's further interested in obtaining how clubhouses bill for that, we can provide that to them. But along those buckets of public money besides Medicaid are city-state contracts, folk rehab funding, housing contracts. Fountain House is the largest clubhouse in the world. They have over 300 members a day, and they are like the A++ of fundraising. They have the all-stars at their clubhouse in this arena. So that's sort of like the public piece of it. The private piece of it is individual donors, grants, and events clubhouses do. So like Lori alluded to as well, when you have a diversified funding stream, you have a better safety net for long-term sustainability.
Thank you both for, sharing your perspective, and yeah, definitely hear the importance of having a diversified funding pool as, for folks who are curious about getting into these waters of Clubhouse. We have some other questions in the chat that sort of relate to, who is this model like most geared for? And some questions we received today and in the registration earlier are about who the Clubhouse serves. So maybe I'll pass this one to Samin and Rita. So we have a question on if clubhouses work with people who have co-occurring diagnoses, maybe people who also have a substance use disorder, for example, or for people who also have an intellectual and developmental disability. So could you, share some insights on that question?
Yes. So at the Clubhouse, yes, we do work with people with co-occurring disorders. We work with people, we have programs that support. We do have, like here at the Clubhouse, we have Double Trouble for people who may have a history with substance use. And we try to support people. One thing that we do at the Clubhouse is that we don't necessarily, the main focus is not the diagnosis. The main focus is the human being. It's the person, and it's the person's choice to want to be a part of this recovery, want to work on their recovery in this kind of environment. So it's not limited to just specific individuals, but we try to open up, and each clubhouse has different ways in which that they support those members who come in with those needs.
One of the documents that Clubhouse is complete, Hadley and Samina, is called a Clubhouse Profile Questionnaire. And in that is demographic information such as diagnoses. So what we primarily see are 4 types of diagnosis that members come with: schizophrenia, schizoaffective, major depression, and bipolar. But the Clubhouse is open to anybody who has a diagnosis of a mental illness. And statistically speaking, as Samin said, about 30 to 40% of our members have a co-occurring disorder of a substance abuse issue. So while we don't treat the substance abuse, we know all the AA, NA providers in the community. A lot of clubhouses might run an in-house double trouble meeting or things like that. So we don't turn a blind eye to that. We provide as much supports as we can to people who have issues in that area.
Great, thanks so much. And Rita, I wanted to pose a question for you, because hearing your experience has been so valuable this afternoon. And I'm wondering, what would you want, or what would you hope more people to understand about people living with serious mental illness and about what clubhouses do for them?
They're people just like everybody else in the world, and they want to be treated equally just as everyone else. It's all about the power of acceptance. You have to learn to accept the unacceptable and deal with it and work with it and learn about the Clubhouse model. I mean, my family learned about the Clubhouse model when, Koreans don't usually know about anything about Clubhouse models. And my mom pushed me to go to the Found House, to come to Found House. She didn't want me staying home, Monday through Friday, like Jack said, playing video games and staying home all day. She told me to go out and do something positive for myself and recover for myself and take me out of isolation from my apartment and work with other people and just try to recover from mental health.
Beautifully said. Thank you so much for sharing that. And the support that you got from your mother is interesting to hear. Families are play a part sometimes in the Clubhouse model. So it was great to hear about that encouragement. Another question we received is about how long folks stay with a Clubhouse. Rita, you had shared that you joined and later came back again. Just wonderful to hear that people are welcomed at any point in their journey. And so, yeah, I would just love to hear, maybe I'll pass it to Lori to, hear about this from, your experience at Magnolia House. How long do people stay with a Clubhouse? And is there a goal for people to sort of transition, beyond the Clubhouse for any reason?
Well, we're an opportunity that's lifelong, and that is part of the design and a really important value. So people never have to reach a certain level of independence or they've failed or something like that. It's very purposefully designed to always be there for folks. But we're happy to have people come and go as best fits their lifestyles and needs. Many people want to sustain a connection because socializing might be more difficult. And more than anything, we want to help people not become isolated. But if somebody feels they don't need the Clubhouse anymore, we would celebrate that accomplishment for them as well. So it's really, there's a wide range, but I would say in my experience, the majority of folks do stay connected and or come back if they've not stayed connected for a while. What would you say at Fountain House?
Yes, I would like to say, because I have the pleasure of working with the Silver Center, and it's one of our newer units, which focuses on members who are 55 and older. So a lot of the members have started their careers here at Fountain House, worked full-time, retired, and wanted to come back and find community and do meaningful work. So it's the great thing about the Clubhouse model is that it's not just for the season or a small amount of time that we get a chance to work with people, because we're a real community. And just like with any community, it doesn't stop after 6 months or a year. It goes on and on as long as the person wants to be connected to that community.
So great to hear about that, and great to hear about the work that Silver Center is doing at Fountain House. That seems like a wonderful addition to the work that you do together. Another question came in from the audience about partner organizations, such as advocacy groups for people with mental illness. And how can these organizations best partner with and support clubhouses? So maybe I'll pass this one to Jack. The question was from a representative from NAMI in California, looking how to better partner with clubhouses in their area. So what do you think?
Get on their board. Clubhouses that are operated through mental health centers have advisory boards. Those that are freestanding have their own. So first and foremost, get educated and go see a clubhouse in your area. And if it's something that you feel you want to get connected to, ask the specific clubhouse what their needs are. Those can vary. So they might need help with fundraising. They might want to use your connections in the community to open some doors for employment. They may have openings on their boards of directors. So there could be an array of opportunities. Oftentimes, clubhouses will partner with NAMI chapters and be involved with their walks. Almost every USA clubhouse that I know of has a positive relationship with their NAMI chapters. And we've had a number of NAMI organizations be involved with starting clubhouses. I just was in Idaho last week. We have clubhouses in 36 states and Washington, D.C. Idaho is one of the states we don't have, but a NAMI chapter out of Idaho is looking to start one. And I worked with them with visiting a behavioral health organization and 2 hospitals and some other entities in their community. So the impetus to that is through the NAMI chapters. So NAMI chapters could get involved with trying to start a clubhouse if there isn't one in your community. But I would say if there is one in your community, go get your own boots on the ground. Go see it, give it your own sniff tests, ask them what their needs are, and they'll tell you. And so clubhouses aren't shy about, oh my gosh, we could use this help, or so we want to find out what particular skill set people bring and how we can form partnerships, not just with NAMI, but with Rotary clubs, Kiwanis clubs, Chamber of Commerce, Lions clubs. We want to be a part and parcel of the community. We don't want to be that place that people drive by and wonder, what is that program over there? I never knew what that was. We want people to know who we are and partner with businesses, NAMI, MHA, other like-minded organizations, and potential resources in the community to grow the clubhouse and make the community a better place.
Yeah, that's wonderful to hear, and those are great strategies. We're also, hearing some questions about, other kinds of partnerships. So with primary care providers or family resource centers. Would you have anything to say specifically about that, Jack?
I would punt that right over to Lori, given that what she's doing at Magnolia. And maybe her and Rita and Sami can speak to that. And if I have anything to add, I will. But there's a gold nugget from Lori in this question.
Thanks.
Thanks. Well, yeah, I think all of the partnerships that people have described are really important. And we also, I don't know, one thing that we have that's also Fountain House has a similar kind of arrangement. We've developed our own clinic. So in a building behind our clubhouse, we have a primary care and psychiatric services are provided part-time during the week to meet the needs of whatever members want to utilize that clinic. And so that has created a very strong partnership, obviously, with the providers of those services. They're our employees. We also have a really good partnership with the university. We're right on the outside of this edge of the campus of the university here. And Jack, I have to add, is a native Clevelander. So we connect way back. But the researcher is helping us further demonstrate our effectiveness. And we're doing some research with Fountain House and Wayne State University that you saw helped develop the Partners in Care training. So there's a lot of ways people are working to become more and more connected. But primary care in particular, like you mentioned, Hadley, is an important piece. And psychiatry. So sometimes we've not developed those relationships as much as employment relationships. And as a model, we've switched that and not switched, but added to our work to incorporate treatment for mental illness, psychiatric treatment, and of course, promoting health and wellness has been a part of our focus for quite some time.
Every one of our clubhouses has access to a wellness toolkit in their portal. Every one of our member clubhouses has a portal with employment, communication, wellness toolkits. And so clubhouses are making a much more concerted effort. When I go back to that statistic about people dying so much sooner, the mortality rate being so much higher for people with mental illness. So clubhouses are not only trying to form more partnerships in the psychiatric community, but with their general practitioners. How sometimes people take for granted an annual physical or getting dental coverage. For many of our members, they don't have dental support. Dental treatment is if you have a sore tooth, you get it yanked out. That's horrific. And so clubhouses will form funds to help members gain access for dental support, and also try to enlist the partnership of local GPs to make sure that people are getting annual checkups and the same kind of access that those who are have full-time jobs have health insurance plans. So there's a big thrust. We have a standard related to wellness, and we look at things from the food that is being served at the clubhouse to Fitbits that a lot of clubhouses have, to discounts at local gyms that clubhouses have for members to use. There's a wide range of wellness types of supports and partnerships with general practitioners, dental and psychiatric.
And I would just add too, I think a lot of clubhouses are helping train police, and their positive relationship with the police department is another really cool relationship to have. Homeless services, developing housing, like all of the things you've heard about. But I think we also really work, and it's been to our benefit, to make sure legislators know us, both at the federal level and the state level and locally. And I think a lot of clubhouses focus on those partnerships too.
Yeah, it's really great to hear about, it seems to me that the clubhouse is all about community, contained in the clubhouse, but also recognizing the community it's in, and engaging partners so that, there's a good, relationship all around, and building awareness, and, anything that can support the clubhouse members and enhance the community itself. I've got a question for you, Rita, on engagement. So, we were just talking about, making relationships, how the clubhouse and clubhouse members can make relationships with others in the community. But I'm wondering, like, when you're a new member at the clubhouse, or there's a clubhouse member, like, potentially thinking about joining the clubhouse, sometimes they might be shy. What are some ways that Fountain House and you and others have tried to engage members to make them, feel like they belong to this community if they're new or considering joining?
I would say introduce yourself first. Be the first person to say, hi, how you doing? What's your name? My name is Rita, what's yours? And you have that friendly exchange between the new member and yourself. And you talk a little more about yourself, and then you ask them about what they know about themselves. And you find that commonality between as a current member and a new member. You find some small commonality between the person that you're talking with. And that's what I found out with some of the members that I talked with. I found that they like to speak Spanish, or they like to listen to the same music as I do, something like that.
Wonderful. It's a powerful way to, establish relationships and start to get to know people. Thanks for sharing that. We have a whole bunch more questions in the chat. I'm trying to keep up. One that we received in the registration has to do with, when things are hard at the clubhouse. Not every day, for anyone anywhere in the world do things go smoothly. So, what is it like at the clubhouse, and how do staff and members deal with situations where, someone might be, acting in a disruptive way in some way to the wider community? Our clubhouses sort of, have a way of sort of addressing that, because it's inevitable. It's just part of life. So I'd be curious to hear maybe from Sabine on that.
Yes, so you're correct. We're all human beings, and sometimes people have a really tough time. But the beautiful thing about this community is that we work together when situations happen like that. The big part of social practice is the relationship. So who's that person who has a great relationship with that person who's having a tough time? It might be a staff person, it might be a member who has a great relationship. A lot of the members in this community, they value their membership, they value being a part of this, and that when they're having a tough time, we can utilize different strategies of kind of de-escalating usually it is helping someone remove someone from that area. Sometimes it is that person might have to leave for the day. However, there's consistent follow-up. So even if someone leaves for a day, it's not like, okay, we're not going to call that person. Did you get home safely? What's going on? Sometimes it's a greater issue that's going on. It could be with someone's housing or with a family member. And I think that we deal with individual situations as they pop up as individual situations, but we work together in the community to kind of diffuse things, and we use our relationships, and also we do our follow-up. Like, that follow-up is really important to help find out what's going on with that person, because usually those disruptive days, there's other issues happening going on, and we can work together to find some common ground. And I will say this, even in those moments, we are able to build better relationships with each other because our members know that we're here for them, that they're not going to be just left alone, that if they had a blow up today, that we can talk through it, and you can come back tomorrow and get back on the ball and be a part of the community.
That's great to hear, and absolutely important to recognize, the other things going on in a person's life, and to have that empathy and compassion to work with them is great to hear about. I think we have time for just one last question. I'm going to pass it to Jack. And this one is about, clubhouses in rural and frontier regions. We've definitely see that there's, great clubhouses like some of the ones featured today in big cities. Are we seeing this model being used in more rural areas?
Yes, we have clubhouses in rural and urban areas. Obviously, challenges with rural issues have to do with transportation, things of that nature. But we've we have clubhouses. We have clubhouses that have 10 members a day, and Fountain House, the largest clubhouse, has 300. And so some of those challenges include broad-based funding, for smaller communities like that. But the same sort of principles apply for diversified funding streams in that nature. I saw that question too, and they were saying a bit about swinging back to the medical model. I threw my email in the chat and would be glad to talk with this person more specifically, because California is really starting to burgeon. Fountain House is working with a group in Hollywood about launching a clubhouse there. We've had about 6 new clubhouses start in San Diego in the last 2 years. We have a working group up in El Dorado, California, and there's getting to be more mental health funding in California. So out of the 15 or 16 clubhouses in that state, we feel the horizon is promising to get more clubhouses in both urban and rural areas in California. So I'd be glad to have a more detailed conversation depending on what community they're in.
Great. Well, that's very promising to hear. And we're just very grateful to all of you for this amazing presentation. We feel very lucky to have had you join us today. And I hope everyone walks away feeling like they understand more about clubhouses, their value, how they operate, ways to get started in your community. We have some resources on this slide, including Clubhouse International's website, where there are a number of resources like the ones Jack alluded to earlier, including the Clubhouse standards. And there's also a link to the Partners in Care training that was discussed earlier in the webinar. And on the next slide, I just want to mention that if you and your community have developed some evidence about working with adults with complex health and social needs, we welcome hearing about your work. So please submit your resources or ideas with us at the link on the slide. And finally, on this last slide, I just want to let you know that there will be an evaluation survey popping up on your screen when the webinar concludes in just a moment. We would really appreciate if you could fill that out so we can continue to publish content that meets your needs. And just one final thank you to all of our guests who shared their insights today, and to the 7 Foundation Collaborative for making the webinar possible, and also to all of you for joining us today. Thank you so much and have a wonderful afternoon.